Today we will be discussing about breast cancer, and this is also a non-topic already covered in second year syllabus. So regarding breast cancer, it is one of the most common cancer in women according to WHO, that is seen in women. But overall in world, it is only second to lung cancer based on the death due to the cancer. So there are some benign conditions in breast like cyst, fibroadenoma, infections, trauma, microcalcifications. These benign conditions can be associated with the malignancy, but these benign conditions will not be converted to malignancies. Most probably this can be treated completely. So in some cases cyst and all, it is able to recur, but it is manageable. And in some cases microcalcifications, if you are not managing, that can be converted to malignancies, but that is also rare. So benign conditions is easy to treat. Regarding the causes of breast cancer, here the major cause is considered as exposure to estrogen. Estrogen is sometimes having carcinogenic effect. It is able to increase the cellular proliferation, one way, and another way it is also having genotoxic effect. That means it is able to do mutation. Due to the increased exposure, it is able to change the genetic structure, or it can cause mutation. Women will be having increased exposure to use estrogen in some situations like early menarche or late menopause. In that cases, there will be increased exposure to estrogen. And similarly, if the female is not having any children or delaying the first childbirth, or if not breastfeeding the child, in that cases also there will be increased exposure to the estrogen. And other causes of the breast cancer is similar to the general causes of cancer, like increasing the age, and if in case of exposure to ionizing radiation, obesity, lack of exercise, and alcoholism, smoking. And here a hereditary problem is due to mutation to BRCA1 and BRCA2 gene, and most commonly seen in post-menopausal woman who is taking hormonal therapy, estrogen therapy. So clinical features of breast cancer, sometimes it is not identifiable because it will be painless. In some cancers, the patient will be having mastalgia pain. But most common signs and symptoms are a lump or some thickening in the breast. It's usually painless, but it can be painful later stages. And some women will be having discharge or bleeding from the breast. And if the tumor is large enough, the size and contours of the breast will change. Sometimes the color and appearance also can be affected. If there is inflammation along with, there will be pitching and redness over the skin, like skin dimpling and all. Sometimes in rare cases, nipple retraction and ulceration can be seen. And the important thing is, usually if you are dividing the breast into 4 quadrants, the upper outer quadrant is commonly affected. Upper outer quadrant. And next is about the malignant breast cancers. Before that, an overview to the anatomy of the breast. So the breast is commonly made up of fatty tissues. In these fatty tissues, it is interspersed with the connective tissue. Rarely, here and there, we can see connective tissue. So which are the parts of the breast? So breast is having lobules, lobes, bulbs, ducts, and associated lymph nodes, nipples, and all this breast is situated over the muscle. Breast tissues is not having the muscles itself. It is placed over the muscles. Each breast is having 15 to 20 lobes. Lobes can be termed as sections. And these lobes are arranged like the petals of a daisy flower. And each lobes are having small structures called as lobules. And at the end of each small lobules, we can see tiny sacs, which is termed as bulbs. The bulb is able to produce milk. So the lobes and inside lobules and inside bulbs is connected with small thin tubes to the areole, means actual nipple. So these thin tubes is termed as ducts or channels. The ducts will carry milk from the bulbs towards the areola. That means center of the breast. All ducts will come and join and become a large duct. So here in malignant breast cancer, even the duct can be affected. Even the lobes can be affected. That's why I told the anatomy. The types of malignant breast cancers are ductal carcinoma in situ. This is non-invasive cancer, and invasive cancers are infiltrating ductal carcinoma, infiltrating lobular carcinoma, medullary carcinoma, mucinous carcinoma, tubular ductal carcinoma, and inflammatory carcinoma.